Hey, it is Monday. Get your coffee, I've got mine. Welcome to another episode of Right Brain Recess. This is where we take your creativity out to play and you learn tips and tricks to take your medical career and health to new colorful heights. And I am Dr. Laura Salyer. And for those that don't know me, I have a single mission, which is to transform the practice of medicine by teaching health professionals how to color outside the lines and innovate their delivery of medical care so that they can reclaim their autonomy and eradicate burnout. And I have one audacious claim for this episode, which is I believe that burnout is preventable and reversible. And I'm going to explain why. So for those that don't know me, I wrote a whole memoir on my journey from burnout to bliss. It's called Right Brain Rescue. I am not alone. I am just one of many. Over 56% of doctors are burned out. And now more than ever, it's just seeped into everything. Nurses, PAs, paramedics, teachers, every industry is suffering from burnout. And dare I say, a lot of us can have burnout in our relationships, in our parenting. Burnout is a condition, a state of mind that is not only psychological, behavioral, but also neurochemical. And this is where I am very passionate about teaching everyone about burnout and the antidote to burnout, which is creative flow state, which we'll tap into in a moment. Hello, good to see you. So let's first talk about burnout. Burnout is characterized by three things. We have depersonalization, emotional exhaustion, and low perceived personal achievement. So let's dissect that a little further. Depersonalization. It means that you are so far removed from whatever your company's mission or goal is or the intention of the career you signed up for, you don't feel like you have any personal say. So similar to saying I don't have much autonomy. And then emotional exhaustion is pretty standard. You are exhausted. You are depleted. You dread getting up for work. You dread maybe Sunday nights. Or if it's burning out in a relationship, you might dread talking to that person. You know, that's how you know it's that intuitive core that you just feel so depleted. And then low perceived personal achievement. Now, what that is no matter what you do, no matter how much harder you work, it's not making a difference. You don't feel like you're contributing and you don't feel like you're achieving anything. This feels so disconnected from a life's purpose. And our human purpose is to contribute and to be a human being, not a human doing, right? And so burnout is not something that happens all of a sudden, although it feels like it in the pandemic. It's like we all came face to face with what it feels like. Really, burnout happens insidiously. The clues are there, but we may not connect those dots or the pattern, which is why I'm so passionate about talking on stages. I go to conferences or hospitals or other industries just to explain what burnout feels like and recognize it and give solutions and next steps so that we can all be healthier. So when burnout happens, it's not the result of a poor work ethic or a bad boss or the fact that you're not resilient, or maybe you didn't do as many yoga downward dogs, or maybe you didn't sip enough wine. No, none of that is going to cure burnout. Burnout is loss of autonomy. You have no agency, you have no say, and it eats away at you. And really, the core root of burnout, in my opinion, is loss of creative flow. And let me explain this. So for those that don't know what flow state is, it's an actual state in your brain. You can measure it on MRI. It's when all 5 neurochemicals of happiness are produced. So we have dopamine, norepinephrine, serotonin, anandamide, endorphins, and it feels good. So you can get flow state when you're an extreme athlete. Let's say you're hitting the three-pointer in basketball, going downhill skiing. Maybe you're a musician. You can get flow state even from balancing a checkbook. It's any time that you're using all your senses and you're engaged in an activity that feels equally matched to your skills. Surgeons get into flow state. You know, every career gets into flow state. And it's this almost an autopilot sensation where you feel like you're just in that zone, and it's motivating. So these neurochemicals feel good and their effect is long lasting even after that activity has ceased. So the idea for every career is to get knowledgeable enough in your skills to drop you into flow as soon as possible. That is what it means to be adept at your career. It's an autotelic state. Autotelic means addicting. It's the actual event is motivating enough. That's the reward. That is when you feel good and you feel like you're just where you need to be. So a successful career has these nuggets. Think of being a waitress. I was a waitress in college. I loved it. Now in the beginning, learning all that was hard. I didn't get into flow state. It wasn't until I was knowledgeable enough. I understood the menu. I could anticipate when the surge of clients or customers would come in. I could creatively swap out things that weren't available for them. I knew when they would likely need another fill up of their coffee or their drinks. Then I could drop into flow and I could make it fun. You know, that's when you see people that can optimize their career. Relationships are the same way. You know somebody enough, their core values, their kind of core personality, you make it fun and creative and novel. This is the drive of all humans. We don't want to be robots. So when you think of how we're stuck now in medicine with all these burned out doctors, it is because that milestone of when am I going to get good enough at my career to be in flow state, it is pushed back every year. We never can get there. And let's give you like a contrast. So let's take you back to 1997. Let's do 97. I was a second year medical student. So imagine an attending physician in 1997. I can imagine because I was there. This is before Google. This is before the generalization of internet medical knowledge or electronic medical records. I remember tailing on the coattails of an attending physician in awe, because here they are moving effortlessly throughout their day with their paper charts, but they knew their patients well. They understood the family that they were serving so that they didn't have to recreate this. They could just start from the last conversation. They were able to make games for their patients. I remember one attending to help make the pediatric visits fun. He actually cemented a teeny little statue of a hippopotamus on the outside ledge of a window. So he would have the kids run down to the edge of the hallway, look out the window, and report back what they saw, but they had to do it quickly. So what he did is he watched them dart down the hallway and back, and he was assessing their motor and their neurological development, and this was done during a well child visit. It was awesome. Many attendings had these great ways of just infusing their day with flow state because they were in the zone. Another thing I remember is asking this attending with my wide eyes, how do you remember all this? Because I watched as he went from door to door, exam to exam, never writing anything down. And he could recite everything a patient said after that visit hours later, and their physical exam. It's because he had his own style. He knew how to use his skills. He memorized things in his own way. He was allowed to use his brain at its most optimum. Nowadays, we aren't allowed to be unique in medicine. We are required to operate in a certain robotic way. In 1997, they had no interruptions of patients asking about a Google search. They didn't have a lot of extra decisions that were thrust on them. So the difference is now we talk about allocation of time. So we're more likely to get into a flow state when we have high value tasks that we're doing. So tasks that we're trained to do that are unique to whatever our job is. It aligns with the core values and the mission of why we're doing our job. And that gets us into flow. Low value tasks are things that they're just busy work. And so in medical careers, we're taught that you do the busy work to get to this flow state. You're a SCUT, you're an intern, you're a medical student, you do the busy work to get to the eventual flow state. And the flow state's not happening. And it's because we have such a contrast. So the modern attending, they are basically filled with low value tasks. We go to work, we open our computer, there might be a new electronic medical upgrade that we have to then reorient our old pattern of clicking through boxes. It's now completely different, so we have to take time to do that. And we're forced to order and type all our orders in by hand. Back in the day, they could just tell their nurse a verbal order in 1997. Hey, could you order that blood count on Mr. Johnson for me? Thank you. And they could move on to continue doing what they do so well. And the nurses would collaborate. It was a great team effort. Now it is so fragmented and so compartmentalized that the physician is required to almost do the brunt work of all of the duties in medicine, to comply with metrics and mandates. And now, this is my big pet peeve. I'm getting really energized here, so I need a little sip of coffee. Okay. So now I'm really upset with the commercials for the pharmaceuticals. What other industry is advertising directly to the consumer so that they can go and question everything? For example, all the new pharmaceuticals, I mean, they go through all these things. So then the patients are now coming to the doctor visits with knowledge saying, well, I know we just got through this other thing, but I'm going to ask you this question. So these doctors are unable to stay or even get into flow state because now they have to pivot and address why that pharmaceutical isn't even right or appropriate for that patient. So the minute they try to do this, then it's on a defensive. The patient's suspicious. Why? Are you just saying that to get me out the door? You see how this creates a very dysfunctional relationship? No wonder the physician-patient relationship is crumbling. No other industry has this. Do you see, let's bring the wait staff analogy back, when I was a waitress. I can't imagine if I had someone sitting in my seat and I'm trying to go through today's specials on the menu, and they ask me all these questions. Was that beef grass-fed? How, what farm were the eggs from? Do you think that they all the little details. Where was this manufactured? What's the raw ingredients? All those things would totally have messed with my flow. And it's okay to have a few questions, but when you're constantly bombarded, it's like speed bumps in your day and you just give up. You have such depletion of your energy. There's no ability to be in flow state. And I don't know of any other industry that has that many speed bumps and sabotaging mechanisms in place other than the medical industry. And it's really sad. But my hope is, I do think we can cure this. I really do. I think that through understanding the deeper neurochemistry of our brain, of understanding and reclaiming those higher value tasks that are involved in the daily delivery of medical care, and learning how to make more automated or routine other tasks, like maybe getting a scribe in the room that can transcribe the visit, that can allow them to order things. Let the doctor do what they're trained to do. Maybe then we can then teach our students, our residents, and our attendings how to dip back into flow state and do the beautiful creative healing that is the medical career. And I think if we prune back activities that don't serve us, even in our personal life, it's amazing how, if we prune back activities like alcohol or relationships that don't serve us or other things, prune those back, we actually have more energy to carry out our other daily activities, which is why I'm just so excited to deliver this information on the bed of functional medicine that deals with cortisol effects, inflammatory reactions, cascades in our body like intestinal permeability. And so when I go and talk to industries or conferences or speak on keynote stages, I infuse all of this together with flow state, creativity, and functional medicine because they're all important in eradicating burnout. So my goal is to transform medical education by incorporating this self-preservation education. I want to teach everybody how they can learn to access their creative flow state, to bring that back in medicine so they have more autonomy and they can be more joyful and less stressed. And so this is why I'm excited that I enrolled in Stephen Kotler's Flow Genome Institute as a flow trainer. It's an intense 18-week course where I'm learning the research behind the neurochemistry, and I'm going to be able to incorporate this in my teachings, in my speaking, in my mentorship for other colleagues as I help them build their next career as a medical entrepreneur, and even in my patient care, helping them access their flow, because that's why we're here. We want to feel good. Humans are here not to be robots. We're here to be creative geniuses and to live out our purpose. And so keep following, because I'm going to keep sharing some of the stuff I learn along my journey in these right brain recesses. And if you don't get my newsletters, please head to drlaurasalyer.com and sign up so you don't miss anything. And like and follow, whatever channel you're watching this on, like and follow. And if you're on Facebook, I do have a group called Creative Medical Professionals, where I dump a lot of my good stuff in there, whether it's infographics or top tips to run your entrepreneur career, or just introspective things like core values and positive psychology. I love all of that stuff. So I'm glad you joined me today, and I hope to see you again. And I'm trying not to wave after every little live thing here, so I'm going to keep my jazz hands in my lap and instead wish you a colorful and sparkly day, and hope to see you again next time.